Hi, I'm Natalie here at Meridian Health Institute in Sugar Land, Texas. We're coming today to talk to you about a lot of questions we've received about a nebulizer and the nebulizer medications that you may be prescribed for any type of respiratory illness. Today I want to go over with you what the nebulizer is, the parts to the nebulizer, as well as the medication. When you're prescribed a nebulizer, it is an inhalation system designed with the medication for you to breathe it into your lungs. You will be prescribed a box of medication. Some are longer, some are shorter. When you open them, the medication comes in these little metal and foil pouches like this. They come in ampules. These are called ampules. For the medication, you twist off the top, okay? So there's your medication. The nebulizer itself is a compressor. It has a port here for you to attach tubing, and I'll show you exactly how that works, and it has an on-off button. Some of the compressors look different. This is a compact one that you can take very easily for travel if you need to. In the kit that you will get a tubing like this that has an opening on each end. You will get a reservoir cup for the medication. You'll get a lid to the reservoir that fits on just like this. You'll get a port for the inhalation to come out one side and one side for you to breathe. Most adults will get a mouthpiece. If you get a mask, it will fit directly onto this. If you do not have a mask, you put your mouthpiece into the little reservoir like this. Some of them do have a long kind of stretchy hose on the end. You can use it or not use it. It doesn't really matter. So I'm going to show you how this works. So once you put all your parts together, you're going to take off the lid to your medication. You're going to squirt the medication into the reservoir. Be sure to put the entire ampule. You will put the lid back onto the reservoir. One end of the cord, let me put that so it doesn't fall. One end of the cord goes onto the opening port here on the machine. The other end goes onto the bottom of the nebulizer. When you turn it on, the compressor does make noise, and then you're going to start to see steam come out of this. You put your mouth on the mouthpiece and you just breathe normally but deeply to complete the entire nebulizer treatment. The course, and depending on the amount of medication in your ampule, can take 10, 15, 20 minutes. And I'll show you what it looks like when you turn it on. And you can see that it's steaming. So you would put your mouth on this and you would breathe. After about 10 minutes or so, it'll start to crackle because it's running out of medication. If you just tap the reservoir cup like this, it will fall down and you'll get the rest of the medication. Once it stops steaming completely, then the treatment is done, okay? Once you're done with it, you disconnect from this. You can leave the tubing attached to your nebulizer. Once you're done with this, you want to disassemble all the parts, just like this, just like we put it together. And you want to rinse these in warm soapy water and then lay them all out on a paper towel to dry until you're ready for your next treatment. Because saliva and things get onto the mouthpiece and whatnot, it's very important that you wash it and rinse it very, very well in between treatments. If you have more than one medication that you're using back to back, sometimes you'll have albuterol as well as another medication. If you're taking them back to back, you can go from one to the next. But then once you're done with that, you want to rinse it with warm soapy water, lay it out on a paper towel to dry until you're done. Okay? We're here for any questions that you may have. In times like these, it's very confusing when you're getting medications and machines and whatnot that you've never used before. You can always give us a call here at Meridian Health Institute at 281-265-6565, and we're glad to help you. Thank you.